Good evening, everybody. I'm Betsy Fischer Martin, the Executive Director of the Women in Politics Institute at American University. And welcome to our virtual series, Women on Wednesdays. We are glad you could join us this evening. To those of you new to one of our events, WPI is a nonprofit and nonpartisan institute in AU's School of Public Affairs that aims to close the gender gap in political leadership. We offer academic and practical campaign training and facilitate research and discussions like this on the role of women in our economy and society at large. Along with our sponsors and partners at AARP, we are so pleased to convene a special discussion tonight on meeting the challenges of family caregivers, no matter what the age. There are about 38 million family caregivers here in the U.S. who provide an estimated 36 billion hours of care to adults. The estimated economic value of this unpaid contribution, $600 billion. And as we all know, a large majority of caregiving responsibilities fall on the shoulders of women. In fact, a recent Department of Labor report found that caregiving responsibilities for children and for aging parents cost women nearly $300,000 in lost pay over their lifetimes. We wanted to explore some of the critical issues around caregiving and the pressures that are facing women really of every generation. And to anchor our discussion, there's two new publications from AARP. They have a new scorecard on long-term services and support that ranks states on their long-term support for older Americans and their caregivers, and we'll talk more about that. And also a recent report by their Public Policy Institute entitled Valuing the Invaluable, Strengthening Supports for Caregivers. And we'll be putting links to those in the chat if you would like to get further information. But we're pleased to have with us two of the top voices from the AARP, Nancy LeaMond, of course, the Executive Vice President and Chief Advocacy and Engagement Officer, and Susan Reinhard, the Senior Vice President and Director of the Public Policy Institute. And although not with us on the screen, but here in the audience, I also want to thank Kim Sedmick, the Director of Policy Outreach, for her help with tonight's program. And also joining us to shed some light on policy solutions around the issues of caregiving are two incredible members of Congress who co-chair the bipartisan congressional caucus on caregiving called Assisting Caregivers Today, or the ACT Caucus as it's known. And we're delighted they could be here with us today, Congresswoman Debbie Dingell and, of course, Congresswoman Jen Kiggans of Virginia. In terms of the format, I'm going to start very briefly with Nancy and Susan to kind of frame some of their research findings and facts on this topic for just a few minutes. And then we're going to move quickly to our two congresswomen because they've been very generous with their time, and it is a crazy time for them, of course. And so they have a hard out of here at 6:30. So we're going to maximize our time with them, come back to Nancy and Susan for some more discussion, and then, of course, save some time at the end for your questions. You'll see a Q&A tab on your screen, so please feel free on the bottom of your screen there to submit a question at any point during our conversation, and we will do our best to get to all of them. I also want to let everybody know that we are going to have a recording of the program available if you would like to share this recording and program with anyone who missed it. So with that, welcome to all of you. Thank you so much for being here. We really appreciate it. Susan and Nancy, I mentioned I want to start with you all because I just want you to set the stage quickly on two fronts. Why it's important to improve the aging experience for Americans, and from your research and your scorecard, how are we doing in that realm? And then secondly, why is it also important to focus on supporting family caregivers? So maybe, Nancy, I'll start with you on that second question of caregivers and why it's important to focus on that.
Sure. Well, Betsy, it's great to be with you again, and thank you for all you do to shine a light on issues that are important to women. And this is an issue that's extremely important to women, although, as I often say, you've given us those eye-popping statistics at the beginning. Depending on how you define it, there are either 38 or 48 million family caregivers. And this group is the largest, most diverse in terms of gender, age, race, unpaid provider group in the healthcare system. And the fact of the matter is, we talk about long-term care all the time. The little secret is that without these family caregivers, we wouldn't have any effective long-term care system in this country. They are propping up the kinds of support that are being given through the medical community and other places. So we're very pleased to be with you this evening, and look forward to talking with you and to the two leaders in Congress who are really focusing attention on this important issue.
Thanks, Nancy. And Susan, what are your thoughts in terms of how the states are doing? You all issued a report card on this as well. Give us a sense of how states are handling not only caregiving, but the issues around aging and caring for our aging population.
Thank you. So the AARP Public Policy Institute publishes what you just referred to as the Valuing the Invaluable, which, by the way, we have state data on how many family caregivers you have and what the economic contribution is by state. So those who are listening, we can provide that as well. And then we have a state long-term services and support scorecard every 3 years. So we just released at the end of September. And one of the major dimensions is family caregiving in the very beginning. And I can tell you that somewhat disappointingly, we didn't make as much progress in the last 3 years as we had hoped to see. We made progress before then, so that's the good news, but we've kind of leveled off, and there are a lot of opportunities to be had. Having said that, states vary very much. And so in the case of Michigan, so we'll be hearing from Michigan in a moment, one of the areas that we are interested in is called self-direction, which means you can hire a neighbor, a family member, or a friend, and they can get paid, like paid family caregivers. And Michigan is 9th in the country in improving in that area. Virginia is doing very well as well. Both of these states are doing well. Virginia has tripled this since 2011, and Michigan has six-fold increase since 2011. So a lot of this could be attributed to COVID, where we realized people needed to be at home and family caregivers were taking care of them. But the states are really sticking to it, it appears, which is a very good news for family caregivers.
That's great. And so let me bring in the Congresswoman on this front, Congresswoman Dingell and Kiggans. Thank you, both of you, for being here. The ACT Caucus, who knew there was such a thing? Tell us, how did this first come about, and what do you all see as your mission today? Congresswoman Dingell, let me just start with you on that.
I was going to go to my Republican colleague because Republicans are the majority in the House. Jen, why don't you go first and I'll follow? Okay.
You were asking about the Caregivers Caucus. Is that what you were asking?
Yeah, the Caregiving Caucus. How did the caucus first come about, and what do you all see as your mission today when it comes to supporting caregivers?
Yeah, well, thank you for asking. And I'm relatively new. I've been here about 9 months in Congress, so I wasn't an original founding member. I believe Congresswoman Dingell was, but and she can speak to that. But it was a great privilege to kind of restart it and to be a co-chair, a bipartisan co-chair with Congresswoman Dingell. So for me, my background as a geriatric nurse practitioner, caregivers were just such an important part of my healthcare team. So the people that I really relied on to tell me how the patient was doing on a daily basis. I wasn't with my patients all the time, but their caregivers were. And there's a lot of other options for aging. And I saw a lot of just wonderful situations in homes with family caregivers. And those were the best health outcomes that we had when you had a family member that could stay home and could take care of their loved one in the home. There are some great facilities too, but facility level care, it has a lot of challenges that I think we're working through. I know when I was a state senator working through a lot of nursing home reform, that was something I was very passionate about, from staffing ratios to just workforce challenges. to during COVID, visitation issues. I mean, it was a lot of issues that as a geriatric, healthcare specialist, I was able to be a voice for. So that was a privilege. So it was really a very easy choice to when I was asked and heard about the Caregivers Caucus. Caregivers need a voice. Caregivers are too busy being caregivers, right? So they rely on people that can speak for them and that can advocate for them. So it's a privilege to be able to do that. It was a privilege on the state level, and it's certainly a privilege to be able to do that here in Congress.
So I'm honored to be doing this with Jen. I actually was not one of the original founders. It was founded in 2015 by the current governor of New Mexico, actually by Michelle LeaMond, who was a caregiver herself and caring for a woman that was disabled and realized the need. And so it was started in 2015 and we relaunched it together. Jen and I became a caregiver myself. And when that happened, I realized how broken the system was and how difficult it was to navigate and how difficult it is to find caregivers, and met so many different people in different settings. And the pandemic very definitively put pressure on people. They weren't able to find other people to help them. Many spouses just became exhausted, and we really saw the need to relaunch this caucus because we need to do much more our caregiving in this country, which is becoming a bigger crisis as baby boomers age.
Congresswoman Dingell, talk a little bit more about that personal experience you alluded to of providing caregiving, having to find caregiving help for your late husband, Congressman John Dingell, of course. What were the major challenges that you encountered, and how did it kind of inform the work that you're doing now in this area?
I was blessed. I was married to the greatest man in the world, and I miss him every single day. And his brain was there every moment until the moment he died. He dictated an op-ed, quite frankly, the day he died. But he did have, he was very stubborn and very proud. And yet he began the last few years of his life, he had mobility problems. And at first I didn't need to have he didn't want anyone with him at night, but I needed to make sure that there was someone there during the day. And you needed less skilled nurse. You just wanted someone to be there to begin with when I was not there. And then as he got older and there were more problems, he developed prostate cancer and had complications. Finding someone to be with him became a real challenge. I found one person that's still very much a member of my family and will always be part of my family. But and I also believed in paying a real wage, because I met many caregivers that were working 2 or 3 jobs and were still living below the poverty line. They were in and out of different places carrying viruses or other things between them. And the other thing that I very much learned was how I'm an educated woman, or I'm supposed to be, that knows how to. And quite frankly, he went into the hospital. He finished his last day of Congress, and the doctors put him in the hospital and said he may have finished his life's work, and thought that he might die. He did not die, but I had, you suddenly realize Medicare is 90 days and you're done. And we had private insurance, and I would be on the phone punching numbers and you couldn't get through. And I always say to everybody, I finally gave up and called my congresswoman. But you just realize how broken this system is and how people can't make the system work. They can't find the help that they need. They can't, even when you have the resources that many don't have, you can't make the system work.
Right. Congresswoman Kiggans, what sort of lesson, what can we learn from the states out there who, frankly, are doing some things well that maybe the federal government is actually not doing? But what can we learn from some models of success that states are having, or, in terms of thinking federal policy in some of these areas that can help.
Yeah, I think I read there was 6 states, is that correct, that offer some sort of tax incentive for caregiving at home, and I think that's something that we need to explore and expand, right?
So tax credits. So
the tax credits, yes,
it's
some way to
for out of
incentivize
pocket money, right? That's spent.
to incentivize caregivers to stay home, because like Congressman Dingell said, I mean, it's you're trying to take care of a home, and if you have children or other family members to take care of in a house, in addition to maybe a job, so trying to take care of a loved one, depending on their severity of their chronic condition, is very time consuming and very taxing. So we have to be mindful of that, because oftentimes they have to cut back on their hours or even quit their jobs. So how can we provide a financial incentive for them to do that? I think there needs to be a little bit of accountability in place. I'm cautious, on bad actors too, because I think that we need to be protective of our older adults, but it's something to consider, be that state or federal. I think, state, you talked about different rankings of states, and we've done some good things in Virginia. I know we pushed for staffing ratios. We were one of the states that I think could do better. When we looked at that issue in the state house, we compared the 50 states, and what different states, some did a better job than others, just of considering for facility level care, times a day. So how are we?
That means sort of like regulatory stipulations on the actual ratio of caregiver to patient.
Yeah. So I mean, that's another challenge that's for facility level care, but but when you think about providing home care, I want to incentivize those caregivers. It's the education part is hard. When I worked in primary care, a lot of my battle was educating my patients and their caregivers on the resources that were out there. It's nice when there's like a mayor's commissioning on aging, or there's some other, the Alzheimer's Association was really good. But just putting that information in one place so that caregivers had those resources and could find them easily, because that's half the battle. There's not a lot of geriatric specific healthcare providers, and so in Virginia, even as a nurse practitioner looking for employment, that there wasn't a lot of places to be employed. I think some states do it better. Florida seems to be doing a great job with more specific geriatric healthcare, or hospitals that are more prone. So a lot of room for improvement, be that federal issues or state issues, but just across the board, we need to do better.
I wanted to ask you also, because in addition to your nursing background, you're also a veteran Navy helicopter pilot, and you're on the Armed Services Committee, Veteran Affairs Committee. What sort of challenges are facing female members, of the military and the veterans community when it comes to caregiving? Are we doing enough in that area, even in terms of veterans VA benefits for?
Yeah, I mean, no, because I have so many veterans in the district I represent now in Hampton Roads, Virginia. And they don't know what's out there. They don't know that the VA can build a ramp for their home. They don't know that the VA can provide nutrition supplement drinks, or adult diapers, or whatever their need, or even provide respite care. They don't know that those resources are out there. So I think education is a key component. Expanding scope of practice for people like nurse practitioners or non-physician providers. I think that the VA has done a better job than a lot of places at making sure that we're practicing to the full extent of our certification, because there's providers. We don't have enough people to provide that care. So how can we kind of fill in those gaps of care with people that are like nurse practitioners or physician's assistants? But I'd say education really for the VA, and then every place is workforce challenge. So that's one thing that we do on the VA committee, is you make sure we're attracting quality employees to take care of our veterans, including our older adults, and a lot of other room for improvement. We're in the process of changing up the electronic charting system. I think there's continuity of care issues that I continue to work on, but yeah, just that education piece and providing some options for our veterans.
Yeah. And Congresswoman Dingell, what do you see as some what can we take from the states when we think about what the federal government can do? And also, I just wanted to expand on the point that was raised earlier about, paying a living wage that you mentioned to caregivers. And, you mentioned the struggles of even finding a caregiver, and what kind of resources are out there for people in that respect.
So there are all kinds of issues that you can talk about when you talk about caregiving. First of all, we have the sandwich generation.
Right.
By the way, women are far more impacted than men, because that's why so many women left the workforce during the pandemic and haven't returned, because when we talk about caregiving, many want to child care is very important, but many, and women in particular, are taking care of both children and parents.
Right.
And it's a sandwich generation, and we don't have enough caregivers. We have a shortage of people because we don't pay them well enough. And I think one of the things we have to do is incentivize people to want to, we need to appreciate caregiving for what it is. All other work is possible when you're not worried about the person that you love and that they are getting the care that they need. And we need to put a premium on that, on caregiving to start with. I think many states are doing it right, and there are states that are not doing it right. We've got a system, here, many people cannot afford long-term care. They want to stay in their own home, in their community, so that we want more home. It's a bill that I've had with Senator Casey that we're going to keep pushing for home and community-based care. There are more than a million people that are on the waiting list for that now. And Medicare is managed at the state level. And we need to get the national program through, but then states have programs that can incentivize that, and we need to place a priority on that. I think, quite frankly, we need to get some other changes just to healthcare, period. That right now there are many spouses. It's that we have two programs that we've been able to extend by a year. One's the spousal impoverished legislation, because the way it is now is Medicare is the largest payer of long-term care in this country, and to qualify you can't have any assets. So
Medicaid,
Medicare, I meant Medicaid. Sorry about that. Thank you, Betsy. Medicaid is the biggest, but in order to qualify you can't have any assets. So therefore people are being forced to sell their homes, to not have any assets. And then if a spouse dies, the spouse is impoverished, and that's not. So we need to be really looking at all sorts of different issues. And we want people to live longer. They should be able to live longer. And many people are able to continue to work. We want to give them the quality of life. So there are programs that are working in some of the states. There are states that aren't paying any attention to this. And we need to take the best models and learn from that, get some of these things done at the federal level, and then help states be focused on ensuring that seniors, and I don't even like the word seniors, because it's a good word, but we're living a longer time, and we tend to put this taboo or something on, especially right now. We're all talking about age. Age is a state of mind for some, and there's some who do get serious issues. Alzheimer's is horrific. Dementia is horrific, but there's some that are in their 80s and 90s and are dancing away. It's a complicated issue.
Well, on the Medicaid question, though, and the eligibility and sort of like the spin down that you mentioned that so many people have to do in order to get their assets under a certain level. And by certain level, I think we're talking about like $2,000 in most places, right? So not really having any kind of assets. Should there be changes in sort of the Medicaid eligibility in that respect? I know it's probably a political hot potato, right?
Well, I've never really talked to Jen about this, but we are trying to get changes. We've been introducing legislation so that spouses aren't. We really need to address long-term care in this country. And by the way, if we could get home and a community-based care, then you would find that is less expensive than institutional settings, which, by the way, are more expensive. You can't find the caregivers for. We've seen during the pandemic, there were real issues in many states with the number of caregivers they have, and that what was happening. So we would be able to save money if people were able to stay in their own homes.
Mm-hmm. Mm-hmm. And I guess Congressman Kiggans, let me close with you because I know you guys both have to hop. But you and Congressman Dingell are doing this on sort of on a bipartisan basis. Do you feel that there in this current Congress is an appetite for listening to bipartisan solutions on some of these problems? And how do you go about convincing your colleagues of the importance of some of this?
Yeah, I certainly hope so. I mean, in my opinion, healthcare, like probably a lot of other issues, shouldn't be a partisan issue, right? I mean, we should all want to provide the best quality of care for everyone. And so healthcare has never been a partisan thing for me. I think there's some education that will be required. I mean, I think, anytime, especially anything that costs money in this day and age, we're facing some other struggles with economy and spending and all those things. So when we ask for money to do different things, then part of it's education about why it's so important. So I'm happy, to use my voice there. I don't disagree with Congresswoman Dingell just about the need for nursing home reform. And it was so frustrating and so sad for me when I took care of patients in memory care, and for them to spend all of their savings on facility level care and then and spend down until they got to Medicaid levels, until it could be covered. And it was so frustrating. Is this the best that we can do? We have to ask these people to spend their life savings and then they can qualify for facility level care, which I agree is not the best option a lot of times. And I see better health outcomes with in-home aging, but incentivizing that and at the same time working on how we can do better. Long-term care insurance is an option. I think it's taken off a little bit it's just a little tricky to manipulate. It's not making sure that's provides proper coverage and that people are understanding what that long-term care insurance does and doesn't do. But that's out there too. So that's probably a step in the right direction. But work to do, and it should never be a partisan issue.
Well, I think the two of you are exhibit A on why we need more women in politics who can be thoughtful policymakers in this very important area. And I think you all are terrific advocates, and just wanted to thank you both for taking the time out of what I know is a crazy busy schedule to come on and talk with us tonight. So we'll let the two of you go, and we'll continue our conversation with Nancy and Susan. So thank you both.
Thanks for having us.
Yeah, absolutely. Thank you.
Bye.
Thank you.
Bye-bye.
So Susan and Nancy, I mean, what are your thoughts when, you hear, two very thoughtful congresswomen kind of laying out the problems and some solutions, and yet, we still have so many of these challenges that don't seem to be at the top of a lot of legislative agendas?
Well, I'll start.
I think you should, Nancy.
First of all, it's terrific to see two such respected leaders in Congress focusing so much on this issue. And I think they are both committed through the caucus to utilizing that opportunity to educate some of their colleagues. And I think one of the things you started with some, as I said, spellbinding statistics, but if you take a step back and think about it, depending on what study you look at, there are 38 or 48 million family caregivers in this country. And that is roughly 10 times more than the number of paid caregivers. So if you think of it, that combination is what is keeping our long-term care system moving to the extent it is. And I wanted to drill down just a little bit on who family caregivers are.
Yeah, please.
I think it helps inform kind of how we see the landscape legislatively. First of all, 60% are women.
Yeah.
30% are millennials or Gen Zs. Close to 30% are caring for both a parent and a child. 60% are in the paid workforce, and an unbelievable 7% are over the age of 75. And that's just part of the picture. So we have this enormous group of people who are providing all kinds of levels of care. We know a couple things. One is there are going to be more older Americans in the future than there are today. We know roughly 2/3 of all older Americans have chronic conditions, and increasingly have chronic conditions like Alzheimer's, ALS, MS, Parkinson's, that require a lot of care during that period of end of life. So this is going to be an in-demand, unpaid job for a great period of time.
And Susan, back to you. I want to go back to that scorecard, because I think it really puts a spotlight on, some solutions that states are doing, right? Because, as we discussed, sometimes the federal government lags a little bit behind. What are some other kind of innovative solutions that you all see as you kind of survey the states as to what they're doing, and why is this kind of an important report to put out for people to think about not only how their states are doing, but look at other states for potential solutions?
Right. So just last week, I was in Denver with an organization known as Advancing States, which includes pretty much the state aging directors. Many of them are involved in Medicaid as well. And they're absorbing these data. There's 50 different indicators, so there's a lot to absorb. But in family caregiving, as I said earlier, we're disappointed. I mean, we're kind of holding. It's not like we went backwards, but we're not moving fast enough, given what Nancy just said, these demographic imperatives, so to speak. I heard one person, I wish I could remember who said it, called it a unifying human experience. Years ago, it was called a normative. That's sort of a sociological term, a normative experience. But this is, as you point out, all ages. It's a multicultural experience. Yes, it's 60% women, but it's 40% men. They're not totally off the hook, right? So there's a lot going on here. States can do a lot. Some of them have done more than others. And what I'd like to say with the scorecard is, in some ways, we've done some of the lower hanging fruit. We've done a lot, but there's some really tough things ahead. So for tax credits came up, right?
Yeah.
So six states are.
It's only 6 states. I was surprised.
I should say Oklahoma made it in after our deadline of June, right? So they made it, but that's still 7 states. So we have caregivers that are providing more than $7,000 a year in out-of-pocket costs. And if you're a long-distance caregiver, which is only an hour away, it's like $11,000 plus. So there's out-of-pocket expenses that really we should be giving a break to them. And
I mean, we give breaks to people buying, energy efficient appliances.
Oh, that's good.
Right?
Betsy, I like that. That's very good.
Why can't we do that for caregiving? I mean, I think Congresswoman Kiggans raised the point, though, of okay, this is, it could be open to some bad actors, right? How do you make sure that the right people are getting the right tax credits?
Yeah, but let me just say, there's other things too, like sick days, right? So there's flexible use of sick days. We have 18 states doing that. That just means you already have sick days. But could I use it not just when I'm sick, but when the person I'm caring for is sick, so that I can take care of them? So 8 states have done that. This is all done under Nancy's team and others, right, Nancy, that come together in coalitions to move things. And then there's mandatory paid sick days, which you would think that COVID would tell us you've got to have this thing, right? So there's 12 states that are doing that. There's a little bit more since our scorecard. So there are things that are not so complicated. It's can you give these people some sick days, right? Of course, there's paid family leave. And there's one I want to bring up that doesn't get much attention, which is anti-discrimination laws. So we started monitoring this a number, I think in 2011, we started this. And it usually starts at a local level. So it could be a city, a town, a county that says, you know what, you should not discriminate against a family caregiver who's employed. And as Nancy just said, 60% are. So let's make sure that we can keep them in the workforce, because we need them in the workforce, not just for the good of the family caregiver, but for society. We need them in the workforce. Right? And now there are like 7 states that have made it statewide. So we're monitoring this. We have, we work with others. It's not like AARP does all this research on our own. We really do want to work with others that have their data and bring it in. But anti-discrimination is a big deal. And unemployment insurance in some states, it's actually a majority of states, but only Nebraska was just added on, that says for good cause means I had to leave because I'm taking care of a family member, a neighbor, or friend. That's another one that you could have more states take on unemployment insurance. So there's lots of different ways, and I could go on and on, but I'll stop.
Betsy,
Nancy, go ahead, Nancy. Yeah.
Can I jump in? Because
Sure.
you've hit a really important point, which is there's been, of course, there can always be more, but there's been a lot of activity across the country in the states on the issue of family caregiving. In addition to what Susan mentioned, for example, we have passed in 45 states legislation called the CARE Act that requires hospitals to identify the caregiver at the point when somebody goes in and make sure that they're given instructions when the person is discharged. Seems like a small matter, but imagine people being discharged and they don't know exactly when to take their meds, et cetera. So we've passed that in 45 states, as you've mentioned, paid leave over the finish line in around 11 states, tax credits, stipends in 5 states, and also in virtually every state in the country has done something in the area of respite care, telehealth, guardianship, power of attorney laws, funding for home and community-based care. And to your point earlier, it's been bipartisan. If you had told me that our biggest accomplishment probably this year in caregiving would be a caregiving tax credit in Oklahoma, I might have not taken that bet early on. But it was. And so I think the real issue now will continue at the state level for sure. But the reason we're so pleased to have this leadership in the ACT Caucus is that we moved our attention to the federal level. And so many things. I'll add one more thing. Somebody mentioned Medicare earlier. We used to survey our members on whether they thought Medicare covered home care. And the numbers were always yes. And of course, Medicare doesn't cover very much home care. I don't think we even survey them anymore because we know that we have to do this education to say, home care is not really a major part of the Medicare program. It is the Medicaid program, as you pointed out earlier.
Well, Nancy, I'm glad you mentioned that too, because we do have a fair amount of young people and students in our audience today, and I don't think we do a good enough job in our working years, like really doing some of that planning and thinking, because there is this notion, like you said, you're surveying members 50 plus, but I can tell you young people in their 20s have no sense of really kind of thinking about preparing for, older, there is that notion of, oh, well, Medicare will take care of that, right? Not so fast in cases.
Yeah, no, absolutely. And so many more young people, probably a lot of the students you see are also caregivers. They're pitching in. They may not be the primary family caregiver, but they're pitching in to help their mom and their dad take care of their grandparents. And as I said, it's a growth profession.
Yeah.
I think it's something like 7% are people 18 years and older are like taking care of their grandparents. It's like a really big deal.
Well, and in many ways, when you think about that, kind of this intergenerational caregiving can be a positive force, right? This can be, something where even in the cultural sense, being able to have responsibility and provide care for our loved ones, and finding the resources to do that in an effective way, and then also to try to supplement paid care where available and where affordable. Nancy, because you mentioned the CARE Act and sort of this notion of, coordinating with caregivers upon the release. And I think, a lot of people are probably like, well, how do I find a caregiver?
Yeah.
Where do I go? Who do I talk to? How much is this going to cost? Are there resources that you all can provide and places that you can point people to kind of find out some of this information? Because I can tell you, having been there myself, it's not easy. Yeah,
and I've been there as well. Well, certainly on the basic education, we recommend people go to our website, aarp.org/caregiving, and we have a lot of very good resources there. We have a prepare to care guide and a financial workbook for caregivers. We have an online resource center. We have community and discussion groups, which can be so helpful. And I popped on one of them a week or so ago, and frankly, most of the people talking were younger. Everybody thinks all caregivers are my age and white-haired. Turned out there were a lot of younger folks on it. And then we're also, AARP is partnering right now with United Way in a number of communities. We hope to expand it nationwide on a project called 211. And it's the 211 number that if you call, you're directed to caregiving resources in that community, because we know that you have to find them in the community. And sometimes it can be very, very hard to do that. So all of these are educational tools that we're trying very hard, other groups are as well, to bring directly to caregivers, particularly as they suddenly find they're in this role.
Yeah. We do have several questions, so I want to try to get to as many as I can here. Here's a question from Kara, who says, this is such a big deal as more and more people choose to or end up solo aging. Yeah. So no spouse, no children. Who do they turn to?
So I'll take that on a little bit, Nancy. You might want to jump in. So my advice in general has been, have a lot of friends who are not just your age, but younger people as well. Make sure you're supporting them also. I don't mean just like, oh, you got to take care of me when I need it, but just really work to have a multi-age, multicultural network, no matter whether you have a family or not. I mean, it's a very important thing for your own brain to be talking to people from different perspectives. But I think that's really important. And I just want to say something about younger family caregivers, which is maybe 3 or 4 years ago, we did some dinners with younger people who were family caregivers. And the thing that struck me, I started calling it Age Interrupted. There was a movie a long time ago about Age Interrupted or something. And it really struck me that these caregivers they don't know each other. They feel like like most family caregivers feel like they're alone. But if you're a young family caregiver, your friends are doing all kinds of things. They're partying, they're doing wonderful things, and they don't know your experience. And so they're making decisions that affect, are they going to take this job? Are they going to move across the country? Are they going to get married? Are they going to have a child? I mean, major life decisions that are around family caregiving. I was so humbled by their experience. It really made me want to do much, much more for younger family caregivers.
I want to just jump in too with another thought, and that is, we're in getting ready to be in the middle of a campaign cycle and year in 2024. Nancy, I know you all do a lot of advocacy and polling and education and surveys of people to think about, what political issues motivate them. How do you see this issue shaping up in the election? And are candidates going to be, campaigning on this issue in any realm, and are voters going to kind of demand answers to some of these problems?
Well, I think we are going to see this as more of an issue than we have before, and part of it is that we expect 50 plus voters to be the majority of the electorate in 2024, as they have been in election after election. We did a survey in the battleground states, the battleground districts that folks think will be the most important. And, 85% of voters over 50 said they were extremely motivated to vote, compared to 67% of voters age 18 to 49. So we think the sheer number of older voters is going to be important. Many of these older voters are caregivers. If you look at the statistics, and especially older women voters, large percentage are caregivers. Every time we poll, every time we look at issues, and you're as experienced at this as I am, the two that always score the highest, of course, are Medicare and Social Security.
Right.
But interestingly, in this poll we did, roughly 77% said that policies helping seniors live independently at home was either extremely or very important for their vote. And I think that's a post-COVID realization. COVID really focused people on, what am I going to do if I get sick? Who's going to take care of us? So we think it's already an issue out there, and we're going to do our best, to be honest, to ensure that everybody running for federal office is asked by us, what are your plans to help family caregivers? Because as we said before, there's been activity at the state level, not nearly enough at the federal level.
Right. Here's another question. How do you define a direct care worker? Are these people trained, and why are they so hard to find? We alluded to that a little bit earlier. The questioner says, Congresswoman Dingell said it doesn't matter even if you have money. These people are an important part of supporting family caregivers. Is there, when you think about sort of that notion of pay equity, what can be done in that respect so that caregivers can earn a living wage in many places that they aren't?
No, I'll start, but Nancy has direct life experience in this. So let me just say our scorecard addresses wages and direct care workforce. And these are new in this scorecard this time around. This is a 5th scorecard. So this is new attention to direct care workers. Direct care worker is a very broad term. It can mean a home health aide, a personal care attendant. It's somebody in a nurse, CNN, they call them certified nursing assistants. So it's a very broad term, but it means kind of frontline and those that are giving personal care, regardless of how they're paid. And one of the things we looked at was the wage disparity across states. And every state pays less for a direct care worker than they do for a comparable worker who has like similar entry requirements, I'll just say, whether it's McDonald's or something like that.
So like a retail or
like
service.
Right. And so it's like $1.50 plus difference across the whole country. No state does even as good as another. So that's a problem, right? And there are some states that go up to like $5 difference, like Washington, D.C. is $5 difference, like New York, Florida, Texas. So this isn't our data. This comes from the paraprofessional healthcare industry. So we've included their data and they did all this. So I just want to give them credit. But we're just trying to, like the scorecard, a lot of the times we're just trying to put a flashlight on it, a spotlight on it. Like, why is this? Like, why can't we do better than this? Because it's a problem to recruit and retain direct care workers, regardless of whether it's paid by Medicaid or Medicare. But let me turn to Nancy, who's had to do this herself.
Well, as Susan points out, the real challenge is attracting people to this very, very difficult job.
Right. And then keeping them in the job, right? I mean, the retention rates are dismal.
Yeah, and very tough jobs. And Susan's referring to my situation. My husband had ALS. We cared for him in our home for 6 years with a steady progression of home care workers, in addition to myself and my 2 millennial sons. And when we were in a situation with 24-hour care, the cost per year was roughly $180,000. And the fact that there are very few people have long-term care insurance, Medicare doesn't pitch in, those out-of-pocket costs are really serious for people. So on one hand, you have a recognition that certainly these home care workers should be paid more. This is a very difficult job. On the other hand, you're thinking, well, $180,000 a year is a lot to pay. So it's such a difficult situation for people. And
yeah, it's difficult to afford, but also you want to pay people well so that you have
absolutely.
Yeah, it's a hard circle to square, as they say, right?
Yeah, absolutely.
We have another question about whether if there's any data around race and ethnicity around family caregivers and what that composition is.
Susan?
So the scorecard did include race and ethnicity for the first time, but only where we could get data. And the only place where we can get data is around nursing homes, mainly. So we have like 9 indicators that show pretty serious discrepancies or disparities around race and ethnicity around nursing home care, like pressure sores, for example, or overuse of antipsychotic medications, or the number of hours that Black residents of nursing, predominantly Black nursing homes get versus others, like 200 hours a year difference, but we don't have any data for anything else. So our appeal is for states to start trying, really state and federal governments, to start really seriously looking at data that can help us understand this. All we can do is look at the data, and then others have to explore, well, what's going on here, right?
Yeah.
So the data can only say, well, here are the facts, and then what is happening in this particular state. So we don't have anything particularly around family caregivers.
I wanted to ask you too, because it came up earlier, and we were talking about nursing home workers, but what about nursing home kind of reforms in general? I think a spotlight was put on this, of course, during COVID, but I know that your report card does not issue very positive grades around the board for sort of where we are in terms of nursing home quality and reforms that maybe need to be made in that realm.
I have to say, Nancy, you can add to this, but it's rather shocking to me. I am also a nurse. Shocking to me that this experience didn't create more change. And God knows, Nancy, you've had the states and national staff working at this really hard. To see the number of deaths in nursing homes and the effect on family caregivers who couldn't visit, the lack of vaccines for both staff and residents varied across the country. And that's going to play out again, not just for COVID, but for other vaccinations that are required. It's shocking. We still have nursing homes that have like 4 or more to a room. Like, really? This has
and the fact that they weren't prepared for this kind of thing. Not that anybody would have foreseen, but they're just even emergency preparedness is just not where.
And we did check. Right? There's only 9 states that have what FEMA considers just a disaster preparedness plan that includes a social vulnerability, which means the most vulnerable, which would include nursing homes. We just had a meeting, as I said, in Denver that included FEMA in that conversation. I'll catch up on that, Nancy. So, it's shocking to me. Like, what more do we have to do? None of the states did really well at this, right? They tried different things, but we have got to take this seriously. We can't have even double occupancy. The infection control, the behaviors that occur. This can be done. It can be done, but we have to have the political will to do it.
Is there a role for federal oversight in this too, or is it just state to state?
What do you think, Nancy?
Well, there's certainly a role for the federal government to look at all of the programs, kind of incentives that CMS has, Center for Medicare and Medicaid Services. Much of it will probably continue to be done at the state level, but I think the main story here is we've kind of turned our eye away from long-term care as a major public policy issue. And now we have so many pieces we need to work on. We have the nursing homes that need to be improved. We have home care that needs to be provided for those who want to stay in their homes or need to stay in their homes. We have the paid workforce. We have family caregivers, and that's a big agenda for the federal government. And our great hope, you asked the co-chairs of the caucus, our great hope is that with leaders like them, we can shine a light on, there was a national strategy on caregiving that was issued by the Department of Health and Human Services, a couple hundred recommendations that can be acted on, need to do that. President Biden in April announced an executive order on caregiving. We've already seen very concrete progress out of the Medicare and Medicaid program. I give a lot of credit to Chiquita Brooks-LaSure and Mina Sheshanami for the work they've done to really look at what the Medicare program can do to start to give needed support to family caregivers, including simple training. I tell the story all the time. When I was caring for my husband, one of our home care workers told me he wasn't licensed under to do feeding tubes. So I did a feeding tube. I learned how to do it on YouTube and Google. Now Medicare program is looking at ways to give reimbursement to doctors or nurses to educate family caregivers so that they know more about what they're doing in care.
And by the way, we have a video on how to do a tube feeding.
Well, Susan, I think that was a nice wrap up from Nancy. Is there any closing words that you have before we conclude for the evening? I know it hasn't been the most uplifting of discussions, but it's an important discussion nonetheless.
I will add another, because Nancy's already said it. There is more attention.
Yeah.
So I've been doing this for decades. I'm a visiting nurse by background, like decades, right? And so there is a national plan. There is more attention. We do have an ACT group. We do have attention to this. We have a lot of work to do, but we have much more attention, I would say, and that gives me a lot of hope.
Okay, well, that is a good positive note to end on. And, thanks in large part to all of the work that you all are doing, and really appreciate you both being here with us and your help on this event tonight. I want to let everybody know too that we have 2 other Women on Wednesdays coming up that we hope you will attend. November 1st, we are doing an event with Ms. Magazine, which is turning 50. So now Ms. Magazine is eligible for AARP. Yep. So we are going to have the editor-in-chief of Ms. Magazine on to talk about some of the great highlights during that 50 years when it comes to feminism and journalism. And then on November 29th, we are going to talk about U.S. First Ladies, Diana Carlin, who is one of our adjunct faculty members at WPI, and Anita McBride, who runs the First Ladies Initiative. Of course, was Laura Bush's chief of staff in the White House. They have just co-authored a new textbook about First Ladies. So they are going to be here to talk about that on November 29th. So we hope everybody will come back and join us for those 2 events to close out the semester. And again, Nancy and Susan, thank you so much for being with us. And thanks everybody for joining us this evening.